Yes, they're not always the same. There are different risk levels. If it's a new drug, of course, there's not much information about that, which is why we're doing the study. If it's an old drug, maybe for a new indication, like Dr. George mentioned, maybe it worked in another cancer, now we're looking at colorectal cancer. Or it could just be, surveys where we're following up on patients or doing chart reviews. So it depends on what question the investigator is trying to answer and what information is already out there. Sometimes we can find what we need just by reviewing patient charts, and the patient will still need to give us consent to do that. So they will still be participating in the study, even if we're just pulling information for whatever their standard care is. It's just there's a myriad of ways we can conduct cancer studies or any clinical studies.
There are many breast cancer research studies that have been done over the years that have actually led to the treatment that is standard of care today. So really, even when you're receiving standard care, you're benefiting from research that's been done previously. I think the most common kind of research studies we think of are research where it involves a difference in treatment than is standard of care, perhaps the addition of a new drug. But there are many other kinds of research that are done in breast cancer, including registries where clinicians or investigators will look at patterns of treatment and outcomes, supportive care trials where it's not a question of changing treatment, but it's adding medicine to help combat side effects of treatment, for example. Those are some of the kinds of breast cancer research that are actively ongoing.
Our clinical research trials are based on trying to find better treatments for lung cancer. So we have several different phases of clinical trials. We have our phase 1 trials where we're trying to see if a new drug can be safely given to patients and find out what doses can be given to patients and without causing a lot of problems. Phase 2 trials, when you have a new drug, then you're trying to determine if it's going to have efficacy or work against a particular tumor type. And usually those are small trials, small groups of 30 to 120 people in general. And then we have our phase 3 trials where we're actually looking to see if that new drug works equally as well or even better than what we're currently doing in standard of care.
Yes, I think that's the reason I'm here today, actually. I was diagnosed with small cell lung cancer. I was told that it's terminal. They gave me 2 weeks to live if I did nothing. If I had chemo treatment, I would have about a year to live. And then they gave me the option of a study, and I participated in that, and I was in it for 1 year. And I think it has a lot to do with why I'm here.